Alright, so I'm going to walk into the room. I'm going to wash my hands with some hand sanitizer. I'm going to close the curtain for privacy. And then I'm going to introduce myself to the patient. There's my patient. My name's Savannah. I'm going to be your nurse today. Can I just verify your name and date of birth, please, with your wristband here? Alright, Ryan Boros, and your birthday. Thank you. Okay, and then I'm just going to be checking your glucose levels for you, alright? So I'm going to check the glucose level, either finger prick, whatever. And then it is at 180. So now I'm just going to ask the patient a couple of questions. When was your last insulin dose given to you? Which it was yesterday morning. And where was the injection site the last time that you ate? When you plan on eating again? And then also just any question that you might have about your diabetes. Make sure they know why they're taking the medication that they're taking. Just how to manage their diabetes. If they have any questions about it, you can help them, answer them, and educate them in ways that they might not have that knowledge for their diabetes. Okay, so at this point I would have left the patient's room and I would be preparing my medications. So I would have the MAR up in front of me. And also when I asked the patient when their last injection was in the last injection site, I would have had the MAR pulled up so I knew what medications they were taking. And they're also taking morphine, 5 milligrams every 4 hours as needed. And I would just ask where that was injected last too, which was vastus lateralis, the muscle in the leg. And that's for severe pain, which is 7 through 10. So we're going to say that the pain is within that range and we're going to give them another dose of morphine and then their insulin. So to calculate the insulin, we have our NPH, which checking the MAR is 8 units in the morning ordered by the doctor, subcutaneous. And the regular insulin is based off of a sliding scale from the glucose, which is why I checked the patient's glucose. And also ask them the last time they ate because it's supposed to be given to them before meals. And the patient's glucose was 180. So based on the sliding scale ordered by the doctor, any glucose level from 161 to 180 is going to be 4 units of regular insulin. So with that 8 units of NPH ordered by the doctor and the 4 units of regular insulin, there's going to be a total of 12 units of insulin given to the patient. And then I'm also going to prepare that intramuscular morphine, which is 5 milligrams, and that's given every 4 hours as needed, but we're gonna give it to them now saying that they do need it. So to calculate that, on this vial the concentration says 5 milligrams per milliliter, so the order is 5 milligrams, so then you're just going to be giving 1 milliliter intramuscular of this morphine. So I'm going to prepare both of those here in just a second. Okay, so now I'm going to prepare my insulin. We have our MPH and our regular. And as I said, we have 8 units of MPH, 4 units of regular. So what we're gonna do is we're gonna take our insulin needle and we're gonna draw back air. Oh, first we're gonna clean it. So I'm gonna take 2 separate alcohol swabs and clean the top of the NPH solution first before I inject the needle. Okay, so that's nice and clean. And now I'm going to take my needle and I'm going to double check with my MAR that I'm putting the right amount in here. So NPH, we have 8 units. So I'm going to draw back 8 units of air. Okay, and then I'm going to inject that into my NPH vial just like this. And we inject the air so that there's pressure buildup in there so that we can draw the medication out. Okay, and then I'm going to remove this from the vial, set that aside for just a second, and then I'm going to clean off my regular insulin vial. And I'm going to draw back air for this one as well, just like I did for the MPH. and I'm gonna check on my MAR again. Then I'm drawing back the right thing, and it is 4 units for the 180 glucose reading. So I'm gonna draw back 4 units of air. I don't know if you can see that, not really, kinda. 4 units of air, and then I'm gonna inject that into my regular insulin. All right, so I got my air injected. I'm not going to remove the needle. I'm gonna leave it in there because you wanna draw up the regular insulin first since it's the clear one, and then the cloudy one second. So I'm gonna leave that in here, and I'm going to invert my vial, and I'm going to draw up. Before I draw anything up, I'm gonna do my MAR check again. So this is regular insulin, making sure I have the right medication. And the glucose was 180, so we have 4 units. I injected the air, so now I'm going to inject or withdraw my 4 units of regular insulin. Okay, and once I have that withdrawn, I'm going to have a second nurse check it. So you can kind of see there, that's about 4 units of regular insulin. And then after that, I'm going to withdraw, I'm going to tap it, make sure there's no air bubbles. And then I'm going to withdraw the needle from the regular insulin vial. Okay. And now that I have my 4 units, I had double checked it with another nurse that my regular insulin was correct. I'm going to check it with the MAR just another time to be safe. Okay, so 4 units of regular insulin. And now I'm going to draw up my NPH. So I'm going to put my needle in here. We already put the 8 units of air. Before I take anything out of it, I'm going to check with the MAR again. We need 8 units. So there's 8 units of NPH and 4 units of regular. So I already drew up the 4. So I'm gonna do 8 more for a total of 12. All right, and I'm gonna draw that up. Okay, and then I'm gonna check that with my nurse as well. So there's a total of 12 in there. Make sure there's no air bubbles or anything. And take out my needle from the vial. And then using the one-handed technique, I'm going to recap my needle so that it's safe for me to take back to the patient's room. And then before I do anything else, I need to check my total dosage with the MAR again. So I checked the regular and the NPH. So now I have a total of 12 units in here. So I'm just gonna double check that with my MAR. So there's 8 units of NPH, 4 of regular, 8 plus 4 is 12. I have 12 in my vial. And then I'm going to put my insulin vials back into the Pyxis after checking my total dosage with the MAR. Okay, so now I'm going to be preparing my IM. So I'm going to check the physician's order, and we have an order here for morphine sulfates, 5 milligrams every 4 hours as needed. As I mentioned earlier, I would have asked the patient when their last injection was given, which on the MAR, it was given at 5:46 this morning. So it's well past 4 hours now. And it was given on the vastus lateralis on the leg. So I'm going to be injecting it into a different area when I give the injection to the patient. But for now, we are at the Pyxis. We have our doctor's order for morphine sulfate 5 milligrams, and I'm going to take that out. So I took out my morphine from the Pyxis, and I'm just going to double check it again with my MAR. So morphine sulfate, 5 milligrams per milliliter, morphine sulfate. So we have the right thing. Okay, and now I'm just gonna take an alcohol swab or wipe and clean off the top of my vial, just like that. And I'm also need to make sure that I calculate the correct dose. So based on the patient's pain level, you should be giving a morphine if their pain is from a 7 to 10, so very severe pain. So we're going to say that our patient is within that range. I checked the order, checked the MAR, so now we got our vial. We're getting ready to take out our medication. So I'm going to make sure that I'm getting the right dosage based on the concentration of the vial. So this vial is 5 milligrams per milliliter. I'm not sure if you can see that or not. Anyways, so we have 5 milligrams ordered. So when you use your dimensional analysis, 5 milligrams order with a 5 milligrams per milliliter concentration, you're going to be giving 1 milliliter. So once I calculate that, I'm just going to make sure that everything's right. I'm getting my 1 milliliter, double check my math, everything. So I'm going to take my syringe. I'm going to take my cap off my needle and draw up 1 milliliter of air, since we're injecting the 1 milliliter. So there's 1 milliliter of air, and I'm going to inject that into my morphine here. So we're putting that 1 milliliter of air just like that. So then I'm going to invert my vial like so and draw up 1 milliliter of morphine. So we're getting air right now. Which is interesting. There we go. Okay, and there's still some air in the top there, so we're gonna try and release that and get that right amount. So a little more difficult than it looks. Okay, now I got that 1 milliliter, all the air's out. And I'm going to double check that with a nurse just to make sure that I have the right amount. So there's 1 milliliter of morphine in there. I'm gonna make sure all my air is out of here. Okay, and then I'm going to remove my needle from the vial and recap it using the one-handed method. Like so. Okay, so we recapped, it's ready to go. And I'm going to just double check this whole thing with my MAR again before putting this back into the Pyxis. So 1 milliliter, and we had 5 milligrams ordered, and our vial is 5 milligrams per one, so that's 1 milliliter morphine, that 1 milliliter in there. I'm gonna put my medications back in the Pyxis, and I have my injections ready to go. Okay, so at this point I would be back in the patient's room with my injections all ready to go and everything. I would come in, wash my hands, put the curtain in for privacy, and then I would just explain to the patient what I'm going to be doing. So I'm just going to say, all right, so we're going to give you your insulin and your morphine now. I'm going to be injecting it into your arm and your abdomen. Okay, and then I'm going to do my 6 medication checks. So we have the right patient, Ryan Boros. I'm going to have him check the ID band and then have him restate his name and date of birth. So right patient, and then just check my medications. So I have the right person, Ryan Boros. Here's his chart. His medications are NPH and regular insulin, and then the morphine sulfate. So here's our NPH and regular insulin. We have the 8 units of NPH and 4 units regular, making a total of 12, and I have the 12 in here. And then the morphine sulfate as the IM right here, and we have 5 milligrams order with the 5 milligrams for 1 liter concentration, 1 milliliter concentration, giving us the 1 milliliter of morphine. Okay, so then after I have checked all that good stuff, now I'm just going to identify the landmarks that I can inject these medications in. So there's the intramuscular, or the IM, which can be injected into the deltoid muscle right here. It can be injected into vastus lateralis, the muscle right here on your thigh, on the anterior part of your thigh, and then also the ventral gluteal, which is kind of the upper part of your buttocks. So the last morphine injection for Ryan Boros was on the vastus lateralis, so now this time I'm going to be giving it in the deltoid muscle. And then for subcutaneous, for our insulin, that can be given in a number of different places. So that can be the love handles, the abdomen right here, kind of in any kind of fatty area that you're going to pinch the skin a little, on the thigh, on the upper arm, and on the scapula, or the scapular area, kind of on the back. Most of the time, that's not a very common one. It's typically the abdomen, thigh, or upper arm. Okay, so now after I checked everything with the MAR, I'm ready to inject my medications. So I'm gonna be putting on clean gloves. And I'm just gonna make sure the patient is aware of what I'm doing here, since I already explained the procedure earlier. So first we're going to be injecting the IM, or the morphine. So we're going to clean up the area. We're gonna pretend this is an arm. Clean our area with an alcohol wipe. Okay, and once it's all clean, we're going to pull the skin in a Z-track. So pretending this was an arm, you would pull the skin laterally to the ulnar side on the non-dominant hand, or the non-dominant arm, so that the skin kind of like pulls, and then when you let it go, it pulls back, so then none of the medication like leaks out or anything. So I cleaned it with my alcohol. I'm going to uncap my needle. Everything's right, checked it with MARS, the right dose, right patient, time, route, document, all that good stuff. So I'm going to pull it laterally towards the ulnar side of the non-dominant hand, and then the IM, you insert it at 90 degrees. So I'm pulling the skin with the Z-track and inserting at 90 degrees. And for your IMs, you want to aspirate just a little bit and make sure that no blood comes out. So we had no blood return, so that means that we got it in the right area. We didn't hit a vein or anything, we're in the muscle, and then you would inject the morphine in and release from the skin, pull the needle out, and then release the skin so that nothing comes out. And then you would put a band-aid on, and voila, your patient has the morphine injected. And then normally what you would do is you would put the safety on the needle and put it in the sharps container. But for the purposes of this video, we do not have a sharps container, so I'm going to use the one-hand method of recapping my needle and pretending that I put the safety on and I'm throwing it into the sharps container. So I'm just gonna band-aid whatever, that was my arm. So now we're going to pretend that this is the abdomen, and I'm going to inject my insulin. So I'm gonna clean the area. This is my abdomen now. And I'm going to take my insulin needle. I checked everything. It's, all of the right patient, right dose, right everything with the MAR. I'm gonna uncap my needle. And for this one, you don't really do with a Z-track since it's subcutaneous. You're not going all the way into the muscle. It's just staying in the skin layers. So you pinch about 1 inch for a 45-degree angle and about 2 inches for a 90-degree angle. I'm gonna do the 1 inch at a 45 just because it's more comfortable for me. So I clean the area. Everything's good, right medication, all that. So now I'm going to inject it at a 45-degree angle subcutaneously. Insert my insulin. Leave it for about 10 seconds. and then slowly remove the needle. And normally we would release the safety and put it in the sharps container, but again, we're going to use the one-hand capping method. Cap my needle, pretend that I put the safety, throw it in the sharps container, put a band-aid on the patient if they need it. And then after all my medications are injected, the patient has, you know, band-aid on, I discarded my needles and everything, I would remove my gloves, throw those in the garbage, wash my hands, like so. And then make sure that my patient is comfortable, they're safe, you know, the bed's lowered, they have their call-aid, all that good stuff. And then I would go into the electronic health record, my EHR, and document all of my appropriate findings. So I would document what the patient's pain level was at, for my reasoning for giving the morphine, and then I would also come back after giving the medication to see if the patient's pain was reduced, and then I would also document the sites that I injected. So for my IM, I injected into the deltoid, so I put that in my chart, and then for the subcutaneous, I injected in the abdomen, so I would put that in my chart. So the site, the dosage, which was the 12 units of insulin and 1 milliliter of morphine, and the time that I injected, which we're going to say was about 11 o'clock. And then the date that I injected it, so today is the 7th, and then I would just write any notes on, you know, patient tolerance, the action that I did, which was give my patient their injection for insulin and morphine. And once all of my documentation is done, then that's it.